I'm going to call the Health and Human Services Board to order on August 20th at the St. Croix Government Center in room 1400. Roll call, please.
Sean Anderson, is he excused? Mike Barkalow.
Present.
Kathleen Finley.
Present.
Kathy Leaf.
Present.
Lisa Lind.
Present.
Deb Lindemann.
Present.
Dave Osnes is excused. Julie Smith.
Present.
Greg Telejohn.
Present. Thank you. Minutes were in the packet. Is there any corrections or additions or adjustments to the minutes? Hearing none, they'll stand approved as presented. Excuse me. Is there any public comment tonight? Any public comment? Any public comment? Hearing none, we'll move on. Financial report for July 2025.
Thank you, Chair. The financials through July of 2025 were included in the packet. We have pretty much completed the 2024 audit. There's a few of the single audit items that they're still putting together, but the rest of the audit was presented last night at the admin committee. This means that our 2024 numbers are final. So this is the final number for 2024. When you look at HHS as a whole, we did finish in the black then with a $9,103 balance to the good. Couple other things to bring up. So public health is pretty much right on track. Behavioral health, we have a couple of trends that we've talked about before. Those are continuing. Some of those with the treatment fees, you'll see that they're a little below where we were at the same time last year. One of these items, so the mental health revenue is 46640. That's higher than it was last year, but a lot of that is a direct impact from Winnebago. So 261,000 of that 445 is from monies we've recovered from Winnebago. When you look down here at purchase services, Winnebago was actually, let's see, what's our number? 228,000 higher than it was last year at the same time. And Trempealeau is 134,000. So the big increases in purchase services are down here. Some of that revenue is reflected up here. Without that Winnebago money in there, we're about 15,000 below where we were at the same time last year for mental health revenues. Within CCS, and we had kind of talked about that, there's been some decrease in the purchase services here, which is a direct impact in revenue. Some of that is census, and some of it's just tailoring the services more directly to what is needed. Reducing some of the out-of-county travel to kind of keep it locally and services provided where recipients can continue to use them after they're done with programming. Children's services, good news within the purchase services, that line has decreased. We've seen a decrease in both child protection and youth justice. Increases have been in subsidized guardianship, which is kind of a shift from that kinship care to subsidized guardianship, but the subsidized guardianship is fully funded. So the more we can have in that line item, we get reimbursed. And then within birth to 3, we've seen an increase in those contracted services there. So along with the HHS, Healthcare Campus also has their final numbers in 2024. So they ended the year also with a positive balance of 732,000. So that included the depreciation within there. But then one of the things we've done now the following year is that debt service repayment. So that fund balance that they accumulated prior year will kind of be absorbed this year through that debt repayment service. And then, and again, 2026 will also have that in the budget. Otherwise, the healthcare campus does continue to do well this year. Their revenues this year are significantly higher than last year at the same time, mainly due to census. So we've had, increase in the skilled nursing facility. Our Medicaid rate is doing well. And now we do have Kitty Roads open with some residents in there as well. So any questions for me?
Doesn't appear so.
Okay.
Thank you. Next on the agenda is Family Resource Center presentation on Recovering Together cafes.
So, Mr. Chair, if I could just say really quickly, I won't take long. I just wanted to thank Family Resource Center for coming tonight and presenting on Recovering Together cafes. These were an effort we started back in 2021, I believe, with ARPA funding, a collaborative effort between St. Croix County and Family Resource Center. And what they're talking about tonight is the culmination of a lot of work and success over the last 3 years. So I'll let you take it away. Thank you.
All right, so my name's Cheyenne. I am a parent educator at Family Resource Center, and as Bob said, I've been doing them from the beginning, so I think we just hit our second birthday of it, as we call it our birthday. And so I'm here with Serenity. She's gonna be talking a little bit about her experience. And so the first thing is just our team. So we have 7 of us. And so it's Sophie, she works at the county, and then it's me. We have Kyle, who is a peer specialist. Anna Wilkinson, she's a parent partner for Family Resource Center. And then we have Samantha Bush, who is also a peer specialist. And then we have Krista, who works at the county, and then Annalise, who is a parent educator too. She's not with our team full-time, but she kind of fills in for me here and there. She used to do them at Pierce County, and then kind of stepped away from that one. So she's kind of just stepping in for me when I need her to. So just some background about kind of what the cafes consist of. As you can see, we have a resource table, and so this just offers different resources to people that are coming in case they need something. We just kind of pull things together from the community. And so this last one we had, Recovery on the River, was one of our resources that we had at our table. We have some stuff on Recovering Together. We have some stuff on Family Resource Center, some of the different county services that they offer. It's just a good way in case people are struggling with something that they can go to this table and hopefully find it. Otherwise, they can ask one of our team members to if they need something, and I'm sure one of us can answer it. The next thing, so cafes are about 2 hours long. We start with a meal at the beginning, so it's just a way, kind of an incentive to get them there, offer some of those different barriers. And then some of the different things that the cafes consist of is we have vitality agreements. So they say that these aren't rules, they're just things that you have to agree on to be able to be at the cafe. And so you can see them there. There's speak from your own experience. So participants are asked to use I statements because we don't want them talking for other people. It's kind of about your own experience at this cafe. We want to focus on what matters, not interrupting. A lot of people that come to these cafes have littles, and so it's kind of nice to get away from someone that's constantly interrupting you and just have people that are there to listen. No judgments, positive or negative. So we say this because we don't want someone to positively reinforce something someone said and then not do it to another person, and then they're like, oh, what I said wasn't good enough, so just having no negative or positive, which I think of a lot of us think this part is really hard because there's a lot of people that are in recovery and they're like, oh, I'm, 3 years sober, and it's like, you want to be like, woohoo, but we try not to do that. I use that term not lightly, try. Do not give advice. I think that one's pretty obvious. Confidentiality, so everything we talk about stays in that room. It doesn't go outside of the room. And then we just ask that there's no electronic presence, so we want everyone to be focused on what we're in the moment for. The next thing we talk about is some vitality domains. So this is really what the cafes consist of. There is 6 different ones. and I put my lovely drawings on the PowerPoint so that you guys can kind of get a visual of what this looks like. Everything we do is drawn out, and so we don't use a PowerPoint or anything. So we talk about our physical, so like the physical well-being of your body, your mental and emotional well-being of your body, spiritual, so some people think this might be like your religion, but it's not. It can be like music, it can be your time out in the outdoors, so it doesn't have to focus on what your religion is. Financial, so just, how you use your finances, if you're good at it, if you're not good at it. Your social well-being, so members of your family, your friends, coworkers, anyone that really consists of that social network. And then environmental, so really just your surroundings, how that affects your well-being. And they kind of all go in with one another because, if your physical health isn't good, your mental health might not be good, and so forth. And then the next section, so we kind of go into this one-on-one debrief, and a lot of participants think this part's kind of awkward at first because what it is one person talks for 2.5 minutes, the other person isn't allowed to say anything, which is really hard because you want to have a back and forth conversation, so they're just there to like nod, or like you can give a thumbs up if you want to, and then after that you switch and the other person talks. And so some of the one-on-one questions we did at our last cafe was we try to start off lightly and then kind of get in deeper. So we said, what's your favorite picnic or grill food? So they'll talk about that, and then they can talk about how you spend a day off. And then the last one was how you celebrate accomplishments. And then after that, we do kind of a one-on-one debrief. So we talk about how that made them feel. And like I said, a lot of people are like, man, that was really awkward because I couldn't talk for 2.5 minutes and I wanted to talk back and ask questions. And then the biggest part of the cafes are their conversations. So we follow these little cards. The hosts that are at the tables pick out different cards that they want to talk about. And so it's 3 different questions. And it kind of bases off those domains that I was talking about, like the physical and the mental and emotional and stuff. And I did put some example questions that we have talked about in the past. So how do you manage your thoughts and feelings to keep your recovery moving forward? And how do you deal with stereotypes about your struggles? So usually there's 3, and then they pick which one they want to talk about. Sometimes we'll talk about a couple of them at the tables. And then after that's done, they get to write a commitment card to themselves. And so after 2 weeks, I send them out in the mail, and they get to receive them again in the mail. And so we did one thing I'm proud of this year is, and then they fill in the blanks. And so it's kind of like a commitment that they're making to themselves over the next couple of weeks. And they're reminded of that when it comes in the mail. And then we talk about some different aha moments, so different things that you're kind of surprised about or things you're taking with you into the next cafe if they choose to come. And so those are usually helpful because people think of all sorts of different things. And then we kind of close with a one-word closing. So they say that everyone has to participate in this section. It can be one word that describes how your cafe went, like how you felt it went, or it can be a hashtag. So sometimes we do get hashtags if they want to mesh a few words together. This one can be difficult too because I think a lot of people have so many emotions when they come to these cafes that they don't know how to sum it up into one word. And so it does take some time sometimes. And then just to talk about attendance. So recently, we've been having full classes, and we actually have a wait list. So we allow 12 participants to come because that's kind of all the room we have for them right now. And then our wait list usually is up to 5 or 6 people, and sometimes they get called, sometimes they don't. So we have people that are really wanting to come to these cafes. And we do have new people at every cafe, so it doesn't fail. Every time we have one each month, there's a new person on our registration. So we're getting the word out, and people really enjoy them and want to attend these. Who helps at the cafes? So we have 2 hosts, so they stand at the beginning and kind of talk through this book that we follow. I don't think any of us have ditched the book yet. We're all like, this is my little baby that I have to talk from. And then we have 4 table hosts, so they kind of run the conversations at the table. And then we do have 2 child care providers. They're usually parent partners for Family Resource Center too. And we do have incentives, like I kind of mentioned earlier. These are just kind of designed to help remove some of those different barriers that families might have when they're trying to attend these cafes. So we do offer a gas card to each family that attends, so that can help them with transportation. Free childcare, so if they have kids and they want to send them over to childcare, they're free to do that. We do have a free meal as well. And then we do offer a raffle basket. So this last cafe, we did the s'mores raffle basket. And so we hand out cards. Whoever gets the joker wins that raffle basket. So kind of a fun way to get them to keep coming too. And I did put just our flyers. So these are some examples of flyers that we've had to kind of spread the word to get people at our cafes. And I know a lot of our partners are really good at sending these out to people. And then some differences. So there's a lot of differences between the cafes and like your traditional NA or AA meetings. And so cafes are for any type of recovery, so it doesn't have to just be substances. It can be mental health, it can be postpartum depression, it can be addiction, it can be trauma, really just anything someone considers themselves recovering from. And like I said, they're focused on a whole person's wellness rather than just sobriety, whereas sometimes AA is more focused on that sobriety. Cafes don't have an expected path through recovery. They're not the traditional 12-step program. And then they just allow you to connect with people from all sorts of different backgrounds, not just substance use. So I know there's been a lot of people that come from substance use, and then they meet people that aren't on that journey, and they find that they've connected through different ways. And then these are just some things that participants have shared they've changed or that they will change. So I focused on the good and what I have in my life versus what I don't. Each time I feel recharged with renewed sense of healing. Thinking back on it during challenging times helps me keep on track. Those are just a few of them. It was really hard for me to pull which ones I liked because there were so many good ones. And then these three are just some overall experiences. So one person said, overall, I found this experience to be highly valuable, providing a unique opportunity to engage with others in a non-judgmental environment. I appreciate the hospitality of the class host. Just learning new things and life skills from others and seeing that there's many others who have gone through worse in life or similar situations that are helpful because then I'm not feeling so alone. I enjoy coming in and meeting people and hearing experiences and relating to others going through similar things. Another person said, I truly found the positive in my life and recovery and journey. This is a great contrast to NA or AA. It was great meeting new people who are going through some of the same issues with recovery. I gained new insight and a different perspective on some important aspects of life. It's nice to share some of those experiences with different people who are having some of the same difficulties as I am. And the last one, I have been coming to the recovery cafes for over a year now and benefit from them every time. I appreciate the work that FRC, SCV, and the county puts into it. So those were just some of the things that people said. All right, and then Serenity has participated in a cafe, so I'm going to let her speak about her experience during these.
Okay. Hi, I'm Serenity, and I just wanted to share, how the Recovering Together cafes have impacted my life. In January 2024, I went from being a full-time working mom to a stay-at-home mom. I had been working in childcare with my daughter, and it left me feeling used and emotionally drained. So I decided to step away from work and just stay home with her. Around that time, a friend had told me about the Recovering Together cafes, and it piqued my interest. I wanted to see what they were about. Like safe spaces for people of all kinds of recovery journeys. And so I attended a few, and I started feeling some things that I hadn't in a long time, accepted, validated. My emotions weren't like crazy because I had just gone through like this big change. as I kept attending, I started to become more comfortable and open up my feelings, and I realized I wasn't alone. Other people had stories which were different than mine, but I could relate to them, and I really resonated with a lot of different things that other people have said at the cafes. I came from a broken family with a history of addiction and emotional abuse, and being able to share and listen without all that judgment, it was super healing. Then, this past May, my life changed again, and my mom was killed in a car crash. So when Cheyenne reached out to me to talk today, I was like, sorry. I had realized I needed the recovery cafes more. I had stepped away from them for these couple months, and I had been like writing all of these things down about what to talk about today. So I was 33 weeks pregnant when my mom passed, and grieving her loss, and then giving birth, and now taking care of a toddler and a newborn. It's all like just been dumped on me. Been very overwhelming. So in all the chaos, yes, I stepped away from the cafes, but I realized how much I still needed to go and to attend these. The Recovering Together cafes have helped me face and process all of these big emotions in the past, and that's why I'm signed up for this next one in September. And so I feel like life moves so fast and we forget to care for our emotional and mental well-being, especially after these life-altering traumas. And these cafes are inclusive for a reason. They connect people and they offer hope and make recovery possible in many forms. And I'm super grateful to be a part of that community that listens and supports and uplifts everyone through each journey. I appreciate you taking the time to listen to me and how the Recovering Together cafes have impacted my life in the past and current.
Thank you, Serenity. That was wonderful.
All right, and on that note, any questions that you guys have for either of us?
Ray, go ahead.
I don't have a question, but I have a comment. This is what we talk about all the time with upstream work. This is the kind of work that we need in our communities to support all of our community members. There's an epidemic of isolation in this nation, and these are the kind of places that create safe spaces for people to process, like you shared so openly. Serenity, we appreciate that. So again, I just have to say thank you for the work that you're doing. Thank you for sharing this with us, and let's continue to do this.
You say you put out, you have flyers. How do people find out about this more? Or how can we promote it more? Or can we do more?
Yeah, so we're able, oh yeah, I forget she's a little shorter than I am. We're able to print them off and give them to people, email them to people. We post them on our Facebook page. I think the county posts them on their website. I know our partners that we work with are really good at sending them out to people that they actually go to like AA meetings with and NA meetings. So we're getting it out there, but if there's any help or any suggestions you guys have too to get the word out. We haven't resorted to posting them like at libraries or anything like that yet, but I think that could be a good idea too in the future.
Do we need to expand the program more? Do we need to have more?
I mean, it would be helpful because we
And
only
this is
allow 12.
maybe a Bob question, but is it possible?
Yeah, well, actually, in the administration committee last night, working with Administrator Witt, we're looking at transferring, the administration committee approved a resolution to transfer some opioid settlement dollars to this effort to continue it at least for a few years. This kind of, again, what Dr. Finley said, this kind of upstream effort or not effort, but this upstream intervention or program is the kind of thing that outside of traditional services can be very impactful for communities. So we saw the value in this. I certainly, when I stop by the cafes, I see there's a certain magic about them, as Serenity's story can, really point out, I think. And there's value in that. And I think it's possible if the board accepts this transfer of some money from opioid settlement dollars, it won't impact other things that we're already spending that on. It would allow these cafes to continue. As far as expanding them, we have enough money if this funding gets transferred to continue as they are for about another 5 years or so. I would like to see them expanded. I know you've worked with other counties as well, and I don't know if their success has been quite the same, but certainly in St. Croix County, we've had a dedicated team that, like Cheyenne has said, that has been there since the beginning, who just are committed to making this work going forward. So we'd have to talk about how that would work if we expanded it with the money that we have available.
So they're at the services center, right? So it would be, if we were able to expand it, it'd be really nice to keep that, but then add another location perhaps because of transportation issues with that, which we know are known in the county too.
Yes, and possibly because of scheduling for that room, it's just it's hard to find times for that room. So not just the size of the room, but to offer another location maybe with more capacity would be helpful. Again, it's a kind of a money thing, because there's a training that's involved for the parents and the professionals who do this work. It's curriculum based, and you have to be trained on it. So there's a cost to that as well. So expanding the program means expanding the training costs for those parents and peers or professionals.
Is there a certain capacity of the recovery cafes, or is it just a space issue?
I think it's just space and funding, but I don't think there's a limit of how many people you can have.
Okay, I was just curious. I have a building that has space.
Free space?
We can talk about that.
Any other questions? Thank you, both of you. Thank you. Pardon?
I would just add, it's very coincidental, Bob, that you had this on the agenda tonight, right after the funding request last night. But coincidence, yeah. So, you can support it because that's going to be going to the county board at the September county board meeting. It's a budget amendment. We're shifting the funding. When we became involved in this program, it was with ARPA funding a number of years ago now. That ARPA funding has run out. All of those funds have been spent. So we're switching it to the opioid funding, which is new funding that continues to come in. And so your support on that resolution would continue this program.
Thank you. Thank you very much.
All right, thank you, guys.
Item number 3, consideration of the 2026 proposed rate increases at the healthcare campus.
Good evening. How is everybody? I haven't been here for a while. So, one of the things that Faye and when we were doing the budget kind of looked at was is there a different way that we could do the private pay skilled rate? And I did figure it out today that we were going to do different rates based on their care needs in the facility. And good thing we changed our mind, because there's 150 different possibilities for rates on the care levels, and that can change every 3 months. So that would have been quite a workload for our finance people. So right now we're looking at $375 per day. The current is $352. In the area, when we did a survey, they're running from 320 to 400 for all the area other facilities within the area. Kitty Roads, we decided, when we opened up, one of the things we were struggling with, we had the staff, but we didn't have the residents. So we had a couple of residents that were a little bit more needful with their behaviors than our nursing home, the skilled facility, or the memory care unit could manage. So we moved them into Kitty Roads so they could be managed better in Kitty and have the space to wander more and that type of thing. So we need to establish a rate for a longer term person versus a crisis rate. So that's why when you look at Kitty Roads, the $350 per day would be the long-term person that's in our facility. It also helps our staff be more stable in the facility, so we were putting them in the nursing home and other places to keep them employed until we got more residents into Kitty. So this will help stabilize that out. And the $650 is not a change. Under the memory care under Orchard View, we're just increasing the studio and the one-bedroom apartment levels, 3,690 from 3,584, and 4,773 for the one-bedroom to 4,634, and that's the same for the frail elderly. Do you have any questions about any of those?
Well, Sandy, on the Orchard View Memory Care, well, how's that compared to other facilities?
I have one that does just a monthly rate, and that works out, ours work out too, if I find the right paper, now that I've flipped them. Our memory care level 3 in Orchard View is 7,540, and this facility goes from 6,500 in level 1 up to $8,700 in level 3. And then the one bedroom is 8,623. It's still lower than their level 3. That's at level 3. I just went to level 3 for both of them. Oh. And the memory care is 6,440 at a studio level, or the frail elderly, I'm sorry. And like I said, the level 3 is 8,700. And the level 3 for a one bedroom in frail elderly is 7,523. So it's under those rates, but kind of the same type of care needs for both of them.
Okay, thank you.
I move to approve the 2026 rate increases for the Health and Rehab Center campus.
Second.
Thank you.
There's been a motion and second. Is there any other discussion or any other questions? Hearing none, let's do a roll call vote.
Mike Barcalow,
Yes.
Kathleen Finley,
Yes.
Kathy Leaf,
Yes.
Lisa Lind,
Yes.
Deb Lindeman,
Yes.
Julie Smith,
Yes.
Greg Telejohn.
Yes. Motion passes.
Thank you.
unanimously. Thank you. I can hear myself. I can hear myself. Next item is proposal to rebalance behavioral health services for sustainability. Are you presenting, Bob?
Yes, Mr. Chair, I'll start. Hopefully you've all had a chance to read this. My intention is just to kind of review it relatively quickly in summary and then see what questions you might have for us. And Char Lopez is here as well, who can help answer questions. But the reason for bringing this proposal forward is as we looked at our 2026 budget and those purchase service costs that Faye outlined in her monthly review of our financials, it's pretty apparent that those costs primarily for mental health, emergency mental health placements in places like Winnebago or Trempealeau Mental Health Hospital, those costs continue to go up. It's not so much that the number of people going to those hospitals is increasing dramatically. It's more that the rates are going up and the length of stay in those facilities is increasing. It could be attributable to complex diagnoses that people enter with. It could be a combination of that and the difficulty finding somewhere to discharge them to for appropriate care. But whatever the reason is, we see that trend increasing. So the costs that we're looking at for 2026, again, primarily driven by those factors, put us about $800,000 over budget. So we have to find a way to reduce those expenses or expenses somewhere in that division in order to sustain vital services for our public. What we looked at was, in determining that, was we looked at what are the service areas within behavioral health within that division that are mandated, what kinds of services aren't mandated, and then we had to look at, well, even if they're not mandated, how do they contribute to those mandated services that we have to offer? So there's a close look at that portion of what we do. There was also a review of the high impact services to the community, what's vital for us to continue providing at the current level that we're providing them at. We looked at service trends, we looked at utilization, how are these services being utilized, what's the productivity level, that is, what is the number of people coming to us and how many are on a caseload, for instance, and what does that look like? What does the revenue and expense look like for each area of that division? And we looked at behavioral health as a service area, not just this division, but how could we look at behavioral health services more broadly in our department, and how could we think about combining service areas to save expense through one administrator. I think when we looked at this carefully, we came to the conclusion that the area that was most likely, the area where we could most likely save money was in the area of substance use counseling, and that's substance use specific counseling. The trends have shown that utilization of those services has gone down since 2020 by about, I think, 37%. And the revenue that we collect from those services is also relatively minor. It's not to diminish the work those people do that work. It's not that. It's not to say that substance use is no longer an issue. We're not saying that. But we are able to capture some of those folks that come in with substance use disorder diagnoses. We're able to meet with them with our integrated therapist, a therapist that's licensed and credentialed to work with people who have substance use disorders and who might have mental health disorders as well. So they can meet with a person in one session and address any number of things that could relate to mental health or addiction in that one session, rather than scheduling somebody to meet with a substance use counselor and then meet separately with a mental health professional. So we're able to treat co-occurring disorders that way through integrated therapists. In this plan, we look at having that integrated therapist model be the basis for our behavioral health services going forward. And we've already begun to do that work through attrition by hiring professionals with a degree and credentials that allows them to work with co-occurring disorder, people with co-occurring disorders. So currently we have two open positions. We have a mental health professional and a substance use professional, two positions open that haven't been filled for a while. We're looking at this proposal, eliminating those two positions, and that would save about $200,000. However, it didn't quite get us there in our overall goal to find about an $800,000 overage that we had to make up for. So we are proposing that we reduce that substance use disorder, those positions by another two, when those two positions are currently filled. So the proposal would result in those two positions going away at the end of this year. Those two staff members, I've had a discussion with them individually about the potential for their positions to end at the end of this year. It's not something I like doing, but I wanted to tell them individually before they heard it tonight, and certainly that wouldn't have been ideal. So that's a couple of areas. So we're looking at a reduction in staffing. We're looking at also combining the CCS division and the behavioral health division into one behavioral health division. Both divisions do work in behavioral health. It made sense to us to have both under one umbrella with one administrator. So after making the decisions around staffing complement and those difficult choices, we looked at how do we save the cost of by having one administrator over both divisions. Currently, Char Lopez is the behavioral health administrator, and she's also the deputy director. When I created the deputy director position a couple of years back, the intention was for it to eventually be a standalone position, so that position could look for alternative funding sources, help us with efforts like this to streamline service delivery, so internal and external kinds of expansion and cooperative agreements with community members, et cetera. In the 2026 budget, I had asked for a position in behavioral health as an administrator to replace Char's position. That would have cost $150,000 roughly with salary and benefits to fill that position. As part of this proposal, we're saying, okay, we won't ask for that position. Instead, we'll have one administrator, Becky Kerr, who's currently the CCS administrator, oversee both divisions. So we would remove that ask from the 2026 budget and work with Becky on how we could combine these divisions and streamline the administrative side of it to save that money. That's about $150,000. The staff reductions were about $400,000, and we still had a ways to go. So we looked at purchase services, contracted services. We currently pay for 4 beds in a group home setting that we pay for in order to keep those beds available to us when we need to place someone there. The reason for that, and this is not uncommon to do, but the reason for that is because if you're in the moment needing a bed and you don't have one somewhere, you're scrambling to find a place for the person to go. If you purchase the beds, they're available to you. We're still going to keep 2 of those 4 beds in this proposal, but we're reducing it to buy 2 beds, which is about, again, a $270,000 savings there. It does limit our ability to place people in a setting like that, but it still allows us some capacity to do that work, or to do that. And the last thing was the proposal suggests that we take over the crisis calls that come into us Monday through Friday from 8 to 4:30. Currently, we're paying Northwest Connections to handle those crisis calls that come in during that time frame. Char's working with her team to figure out how we can accept those calls and reduce our contract with Northwest Connections by about $36,000. Those things all combined, we believe we can, with those things, we can still meet the needs of the public. We can still perform the functions that we do now in a different way. And we can maybe, through the combination of these 2 divisions coming together into one, I think increase at least the potential for more collaboration and cooperation between these 2 divisions in order to strengthen our overall behavioral health response to the public. Oftentimes these divisions, they're separated because of the funding streams that fund them. So they have unique funding streams that kind of make them different than one another. So that's a factor that prevents them from naturally working together because they have to follow different regulations and different, under statute and rules. They have to follow different guidance for how they serve people. But I still think there's room there for an integrated model where we can offer to the public, here's a whole menu of behavioral health options. which one might you be eligible for or need or want, and help people select those options more effectively. Becky Kerr's up to the challenge, and it will be a challenge. And we certainly have the deepest respect for our staff and the impact this might have on them, certainly the two individuals who would be directly impacted by this. I don't want you to think that this was a cold decision that we just made without thinking about their value and their contributions to the county over the years. So it's not easy to make these kinds of decisions, but I think a lot of thought and care went into them so that we can operate still effectively and meet the county's needs or the public's needs while saving money that we don't have to spend. So I'll be quiet and just see what questions you might have.
Anybody have any questions? Go ahead.
Have you put into or have you thought about how you will monitor the effect this might have on, you know, people that need services or I mean, is there any thought to that? I'm just curious.
We will, and we do monitor. We monitor both productivity, wait lists. We look at are people getting what they need? If it, you know, adjustments will probably have to be made as we get into this to see how we ensure that we're not negatively impacting any particular population. I think our intention was this is going to be a challenge. It's just operationally, I mean, it's going to be a challenge to get to the point where it's operating smoothly and getting people in the mindset of, you know, giving up their identity as being in one division or the other and having them think more collaboratively. I think Shar says a lot of times it's not so much that on paper it's hard to do, it's more thinking differently about how we do our work and trying to do those things that only a county can really do well, as opposed to things that maybe in the community there are other options we could refer people to instead of us trying to do it all. So really trying to be more focused on those things that we can fill a gap in and then refer out when we're not able to, or when there's other options, I should say, for the same kind of service, like substance use. There's more outpatient options now than there was. There's more telehealth options for people. So it's not the same world it was 5 years ago, and I think we have to adapt to that and find ways in which to do our work differently and still be effective at it. We'll monitor things, Deb. I mean, we have to make sure that we're hitting targets and saving on expenses and still bringing in the revenue that we need to stay viable.
So is Shar going to be the deputy director? I was just trying to figure out where Shar fit in the new puzzle.
So the proposal would separate Shar from that role of behavioral health administrator and allow her to, or whoever is in the deputy director role, to really pursue these alternative funding options, to work, and she's already done a lot of this, working with public safety, the sheriff's office, local police departments, the jail, to find alternative ways to work together to bring in revenues and to work with populations that circulate through the jail and emergency departments and our crisis services, to work with them in an early intervention fashion, more preventive care or early intervention care. Char's also in that deputy director hat that she was wearing. I mean, wrote a grant for the Dementia Crisis Stabilization Unit that got us $600,000 and allowed us to fix up the Kitty Rhodes facility, along with, of course, with Sandy and her team's help. But there was a $400,000 grant that she went after for the Office of Violence Against Women to strengthen APS services. We just had a meeting this morning, a community coordinated response meeting that was well attended upstairs with law enforcement and other members of the community who all came together to rally around this cause. And that's the kind of thing that I think a deputy director can help me with, is not just the internal restructuring or strategic thinking around how clinical services could be done differently, but it's looking outside of the organization for ways in which we can help to mitigate some of the challenges that might be coming because of Medicaid changes or other federal funding changes. And we need to have, I think, we need to have a contingency plan for how to manage our services and fund them going forward without relying on some of the traditional funding that we've been accustomed to getting.
So we had our annual jail inspection with Public Protection, and we met Bill, and we're seeing some of this intercept meeting that we had, where some of the things that we talked about there are actually, they're being implemented. So I think there is always a way of changing breaking down the silos, as we say in other places that I work. But I mean, I'm obviously sad for the people that aren't going to be with your team anymore, but I understand that we have to pivot when we can, but unfortunately, some of our federal funding will be disappearing, and that's truly unfortunate for those that need it.
If I could just add something quickly. The other challenge with having a deputy director and an administrator combined role is that if Shar were to win the lottery and leave, the only way to fill that deputy director position would be to go to another administrator and say, hey, are you willing to take on this extra position that involves all these things? It's a lot to ask of someone to do both jobs, and it's, no matter who they are, you can't dedicate yourself to one position or the other. You have to divide yourself up in some fashion. I really think the position could be very effective. The deputy director role can be even more effective if it were its own position, and that position and myself could work towards some of these broader goals.
Any other questions? Oh, you have. I thought you were pointing to something.
I actually was, because I thought she was moving forward. I just want to say thank you for this out-of-the-box challenge that you've accepted. It's hard stuff, and change is real. And the outcomes, like Kathy said, to the people that will be losing jobs, I just wish them well and thank them for their service. But I think this is awesome that you have been able to do this. So thank you.
Do we need to approve this?
Yeah, so ultimately, the county board approves the budget, and this
Right.
is a budget idea. So this is your first introduction to it. I asked Bob to put it on the agenda even before we get to the budget next month, so that you see this and you understand some of the changes you're going to see in September and October. Some of these changes Bob built into his budget request, and some of them I'll implement as part of the administrator recommended final version, like the staffing change. So Bob, in his request, because at the end of July, this wasn't finalized yet. So you'll see it evolve and finalize then through that budgetary process. But I just wanted to compliment Bob and Shar and their team for really taking a look at this. I know these are tough decisions to make, but these are the types of things that we really need our department heads to do, is to look at the services we're providing instead of just doing the same thing year after year. All right, where is my need increasing? Where is my need maybe decreasing? And reallocating those resources, because we have limited resources. So I appreciate this work and the tough decisions that were made in order to make this.
I got a feeling it'd be appropriate to have an approval of this by the board here, the committee here, if somebody.
Yeah, you absolutely can, because it's a recommendation that
I'd like
we
to
build this into the budget.
I'd like to see a motion if somebody would like to make one.
Or you can do it, Virgo. I'll second it.
Motion to approve the budget recommendation and changes.
Any other discussion? All in favor? Let's do another roll call. I like roll calls. Gotta give somebody else something to do.
Mike Barcalow,
Yes.
Kathleen Findley,
Yes.
Kathy Leaf,
Yes.
Lisa Lind,
Yes.
Deb Lindeman,
Yes.
Julie Smith,
Yes.
Greg Telejohn.
Yes, thank you, everyone. And thank you, Char and Bob and everybody else. Requests for future agenda items. Anybody have any requests for anything to discuss in the future? Announcements, any announcements?
I do. Most of them are good news. Our Children Long-Term Support Service area was just audited by the state and received a 97.6 compliance. The state average is 85.1%. They got a really good review for the work that they're doing. I just wanted to acknowledge that. Shar also wrote a grant in her spare time for the State Crisis Intervention Program, or SKIP grant. And that's a $75,000 grant that would result in a jail-based counselor, mental health professional that could go into the jail and provide mental health assessments in the jail, or when people are released, shortly after they're released, to help them get connected with the resources they need while in jail or shortly after their release. We just got the grant award notice for that one. It's a one-year grant. Hopefully it can be renewed. The ADRC received a grant of $20,000 to revitalize congregate dining services, and they're working quickly because that grant money is good through the end of September. But I know Kristen's here and has told me that she's already got ideas for how to use that money. I know, should be out working. We did receive the $100,000 match from Vital Strategies for opioid settlement funds. The proposal was written to support the position that we already have funded through opioid settlement dollars. The substance use professional, Kim Kitzberger, who works embedded within our CPS division, working with families who are affected by substance use. In the match proposal, had to also expand upon her duties a little bit, so she'll be helping with family treatment court, and we'll be doing public health. We'll be doing an evaluation of those efforts as a part of that match funding. We had Shop with a Cop on August 12th at the Services Center. 115 kids were helped by the effort and getting children back to school supplies and that sort of thing. They take them over to Walmart in the police cruiser and take them shopping. And well, the last thing isn't so great, I guess. There was a measles case in Roberts that Adam put a press release out about at the truck stop off 94 there. I haven't heard any updates as to whether or not there's been any additional cases identified, but there was one case, someone from Montana driving through. I think that's it.
Any other announcements from anybody? Any other good news? Date of our next meeting is scheduled for September 17th. And with that, I'll adjourn the meeting. Thank you, everyone.